Hi everyone. This is a video to help with understanding the primary rotations of the scapula. So in addition to the content in Canvas, what I wanted to do is just provide you with a little video representation of internal and external rotation, upward rotation, downward rotation, and then posterior tilt, anterior tilt of the scapula. What I've done is I've purchased a scapula and drilled a couple of holes where the axis of rotation for each of these coupled motions would occur. So to start, let's talk about upward rotation, downward rotation. So this is the coupled motion between the upper trapezius, the middle trapezius, and the serratus anterior, with the lower trapezius more or less serving as a stabilizer to help prevent against elevation of the scapula, the translational movement, and then protraction of the scapula. So if we look at our scapula here, this axis of rotation is going to be through the body of the scapula. So we'll stick our axis through here. You're looking at a left scapula. And what we can do is we can give you the view of the left scapula from posteriorly. Let's see if I can move my hands a little bit to give you a better view. Sorry, it's not fantastic with the fat hands. There we go, we can hold it from behind. So this motion occurring through an axis through the body would result in upward rotation. You can see the inferior angle moving upwardly, and then downward rotation. Upward rotation, downward rotation upon that axis. Okay. Moving on to the next rotation, which we could talk about posterior tilt, anterior tilt. This is a motion that's going to be occurring as a result of activation from the lower trapezius and serratus anterior. And the axis of rotation here is going to be through the glenoid fossa. Okay. So this is going to rotate the inferior angle of the scapula toward the rib cage and away from the rib cage. So if we look at our scapula with the axis of rotation straight through the glenoid, put our axis in there, and this is going to be the motion that takes the inferior angle there at the bottom, and it's going to tilt it either in towards the rib cage or away from the rib cage. Anterior, posterior, anterior, posterior. Okay. And then lastly, the third rotation that we talked about in class is internal and external rotation. So this is going to occur about an axis that runs through the spine of the scapula and is a combination of activation from the rhomboids and the serratus anterior, where the medial border of the scapula is moving away from the rib cage. So you can see on the spine of the scapula here, I've drilled a little hole. We'll stick our makeshift axis rod through the scapula. Medial border is here where I'm tapping my finger. And so this motion, if we turn the scapula, is either going to tilt the medial border toward the rib cage or lift it off. Toward, off. Sorry, without a rib cage to have as reference, it may be a little difficult to visualize that. Out and back. Okay. So those are the three primary rotations of the scapula and their associated axes. If you still have questions about these rotations after watching this video and reading through the material and looking at the images in Canvas, feel free to post in the course cafe or come see me in office hours. Thanks.